Welcome back to the Now Morning Show. Did you know that June is Cataract Awareness Month? That's why in our spotlight today we are talking the truth about diabetes and cataracts.
As we observe Cataract Awareness Month this June, the Trinidad Eye Hospital is actually giving you a lot of information, and they have a session coming up later on this evening that you can be a part of. But before we get into that, we have Dr. Ronnie Bhola, Chief Eye Surgeon and Retina Specialist at the Trinidad Eye Hospital, joining us this morning to chat a bit about diabetes and cataracts. Good morning to you, Doc.
Thank you for having me. It's a real pleasure to be here again.
Nice to have you here in person. It's been a while since we've had you in person, so we give thanks and praises for that. Let's start from the very beginning so that people who may not have ever heard our conversations before get a clear understanding. What exactly is cataract and how does it lead to vision loss?
So the lens focuses light that enters the eye onto the retina, and therefore it's like the window. Okay. And the cataract is usually crystal clear, but once aging is the most common cause, once it starts to set in, the nice clear lens becomes a bit cloudy, and it starts to block that light from coming through that window. And when that happens, your vision starts to feel a little cloudy, like if you're looking through a dirty window. And that is what we call a cataract, when the lens becomes cloudy over time.
But there are different versions of cataract, yeah?
They classify it in multiple ways. The nicest or easiest classification is either congenital or acquired. Okay. And obviously acquired cataracts is much more common than congenital cataracts. And the causes of acquired cataracts is either it's something in the body that's causing it, or aging.
Okay. You know? And aging is the most common one, yeah?
Yeah, 90% or more of the cataracts we see and have to manage is due to aging.
But is there a way that we can prevent it from getting bad as we age?
I think you could slow it down.
Okay.
You know, because we think the sun rays have something to do with cataract generation.
In a good way or a bad way?
In not a good way.
Oh.
Because what we notice is people who lived in the Himalayas and the mountains, they were getting cataracts earlier than people who live a little lower down because of the sunlight, because they're a little bit closer to the sun.
Right.
So we noticed that, and we therefore knew that cataract, there is some UV light that causes or speeds up the growth of the cataracts. And then other things contributed, like your eating habits.
Right.
So we know things like lutein is very healthy for the eyes.
What is lutein?
Lutein, xanthine, these are antioxidants that the body uses to reduce.
Do you find lutein and xanthine? Do you find those in natural, like fruits or vegetables, or where do you get that?
So it's high in green leafy vegetables. So your spinach, don't put it aside and say, not today. It's really healthy for you. Make sure you get that in. And then vary the colors of your fruit, because they have the other antioxidants that you need to reduce inflammation in your body. So your knees get a little better. Your eyes get a little healthier, you're less likely to get cataract as you age.
Okay, so the eating habits are very important. One of the things that I noticed, well, you guys said that you noticed, is that people with diabetes seem to be getting cataracts earlier as well. What is the relationship between those two?
So what happens in diabetes is the blood sugar is hard to control for the body. And when the blood sugar is either high or up and down, that glucose gets into the lens because the blood sugar is high, the glucose gets into the lens, and then it changes to sorbitol, which causes the lens to swell. And that swelling and getting back normal and swelling causes the lens over time to get cloudy, and the cataract generates. So what we notice in diabetics is they get cataracts at an earlier age than non-diabetics.
And is that just as a result of not managing the blood sugar levels properly, or it doesn't matter?
It matters a lot.
Okay.
So the blood sugar control is a key thing. So if you're diabetic and you have good blood sugar control, you're very less likely to develop a cataract. So very important to take your medication and make sure you eat the right foods.
Okay. And once you establish, well, at what point should you be checking, or should you be doing regular checks to see if you have cataracts?
So all diabetics, we recommend that they get screened,
Right.
eye screening once a year if they don't have any issues with
Right.
the eye. So that's your regular
And that's for
checks.
diabetics.
And that's for diabetics.
So what about for people who are non-diabetic?
For non-diabetics, see your healthcare provider, and that's usually every 2 years.
Right.
You know, we recommend you go and get your eyes checked.
Every 2 years to make sure that everything is everything.
Yes.
All right. And if it is you go get screened and you realize, all right, is there an early stage of cataract?
Yes, it really goes through
It
stages.
goes through stages, right?
Yeah.
So you realize, all right, I have the early stage of cataract. I'm now starting to see a little cloudy. Can that be repaired, or is it that you just have to manage it for the rest of your life?
So it cannot be reversed once you start getting the changes. That is 99% of the times. So what we would recommend there is you make sure you wear your shades when you're going out in the sunlight, and you make sure you're eating as balanced a meal as possible, and try and include those green leafy vegetables.
And that would just slow down the process of it happening.
Exactly. That would slow you down. So instead of you having cataracts at 70, you'll probably get it at 80.
Okay.
Because
All
people
right.
living much longer these days. So, you know.
So even if you get the cloudy glass so that you can't see anything, for example, there's no way to clear up that glass, to put some Windex on it, or?
Well, the only treatment still in the world that is well recognized is surgery for cataract. Luckily, it's a reversible condition. And most people we do cataract surgery on tell us, hey, I feel I'm 19 again.
Right.
Because I can see everything, you know. So it's not one, I would say, if you get diagnosed with it, to worry.
Okay.
Because it's reversible. 99% of the time, surgery is smooth. So it's one of the life-changing type of surgeries that has been developed in the last 100 years.
Now, you mentioned that it's related to aging. And if you get a particular age, surgery becomes a little bit more risky. What are the risk factors involved with having surgery for cataract, especially as you get older, if you're 60, 70, around there?
Yeah, the aging doesn't seem to increase your risk too much because 99% of cataracts we do is in the Asian population, and the results are amazing for them. But diabetics have a little bit of a higher risk of having some issues if they're not controlled. So what we try to do is get your diabetes under control, and then we do the surgery. So even if you're diabetic, your risk is really, really small for problems once your blood sugar is well controlled and your diabetes well controlled.
All right, nice. Tell me about the live panel discussion that's happening this evening, the truth about diabetes and cataracts.
So what we want to do is try to bring awareness to people that if you are diabetic, remember it's a lifestyle disease. So the ball is in your court. You know, make those healthy food choices, because they come at you every day. You're seeing it on the road when you're passing. It's tough. 90% of what you see is a little bit of an unhealthy choice. So you have to look away, you know, and really focus on making those lifestyle choices that is good for your health. Make sure you exercise regularly. Put it in your daily plan. Make sure you eat the foods that are really healthy for you. And make sure you get your eyes checked on a regular basis. Because if we could diagnose things early, then we could save your eyesight.
Okay. All right. And the panel discussion, is it open to the public? Is it virtual? Is it in person? How is it?
So it's Facebook Live.
Okay.
So it's open for everybody.
Okay.
And we have Dr. Joel Tiloxing. He is the guy for diabetes, and he is joining us on the panel to really discuss the effect of diabetes on you, and then I do the eye part.
Okay. I also understand that you have Priyanka Prasad as well, or she's just moderating the...
But she's our surgical services manager.
Right.
So she sees all these patients coming for cataract surgery, coming for diabetic eye care, and we manage them together. So she's going to moderate for us.
Tell me something. At the Trinidad Eye Hospital, is it diabetes related to most of the cases that you have to treat?
That's a really interesting question, because I was asked how many patients who come through the door might be diabetic.
Yeah.
And I estimate it's about 60% of what is coming through. And I think it has a lot to do with the foods that we get sold, you know, because we eating more on taste than on health.
Yeah.
And we have to have a little bit of a switch. So I think these forums where we could have a chat about it brings awareness that we have to choose health over taste.
You have to choose less tasty food.
Or make healthy food
Taste good.
taste good.
That oftentimes seems to be the challenge.
Yes, yeah. And you have to make it also more affordable.
Yeah.
That the healthy option is not out of reach. You know, and that's a challenge, I think, for everybody.
In terms of, so you mentioned 60% of the people that will come through the doors may be diabetic, right? Do you think, based on just observing society, do you believe that that is a representation of society on the whole, in terms of where we are at from a health perspective?
It is showing a decline in health in society, in Trinidad, but the Western world.
Right.
And it has to do with the Western diet and food, because it's a lifestyle disease. In the majority of cases, we do have a type 1 and type 2, but 90% of the diabetics we see is because we're not doing the right things and making those right choices.
Very interesting. So we have some right choices to make, guys. You have to eat properly, you have to exercise. That's the top two things that should be able to say, well, we're balancing off anything. Because even if you get it hereditary, you could still say, all right, I can manage this better. Yeah?
Yes. And just see your doctor regularly, because he has to track and monitor how you're going.
Okay.
You know.
All right. Well, guys, if you want more information, there's a live panel discussion happening this evening at 6 p.m. at the Trinidad Eye Hospital Facebook page. You can head across there and just be a part of the session. You can learn some more information, and you can also contact the Trinidad Eye Hospital if you do want to get your surgery, if you want to check your eyes and make sure that everything is everything. Doc, any closing words before we leave this morning?
I think just make the right choice and just get your eyes checked.
Thank you so much for joining us this morning, Dr. Bhola. Thank you for the work that you continue to do and for spreading this message, especially during Cataract Awareness Month.
And thank you for having me. It's a real pleasure to be here.
Not a problem at all. Have a great session this evening.
Thank you.
No problem. Ladies and gentlemen, that's Dr. Ronnie Bhola, Chief Eye Surgeon and Retina Specialist at the Trinidad Eye Hospital, just telling us a little bit about the relationship between diabetes and cataracts and how you can do your part to live a better life and a better eyesight life and a longer life and all that good stuff. We take a quick break and we come back with more in our morning show. Stay tuned.
Silverine.
Have a seat, Sylvie.
Yes, so I also have this for you. It's like a follow-up program. After this lecture, we'll follow up with these.
Okay.
Yeah.